A warm welcome to this talk. It's Thursday the 13th of January. Now, hospitalisation rates in the UK have just about levelled off, but in the United States they're still increasing, and this is a concern. In the United Kingdom it's bad enough. We've got 6 million people waiting for elective treatment, so the sooner we can get all this COVID stuff out of the way, the better. But in the States there are quite significant challenges in most areas now for hospitalisations. And people requiring urgent care are simply not getting it. And of course, sometimes it's just going to be too late, unfortunately. We don't have definitive answers on that, but we are going to look at a few ideas on that. But before we get on to that, and I can't really summarise it because it is a bit complicated. Before we get on to that, let's look at some orientation. So here we have the number of cases. Now, Japan cases are starting to increase slightly with Omicron. Now, India here, showing a slight increase in cases. This is, of course, complete, utter gobbledygook. Cases in India are absolutely going through the roof. I've talked to friends in a couple of different parts of India, and they are just inundated with COVID, Omicron, everywhere, absolutely everywhere. In hospitals, the clinicians I've been talking to, but also relatives, friends. Omicron just seems to be everywhere in India now, so absolutely romping through the country. So that is inaccurate, but it's what we've got. Canada, we'll see why Canada's inaccurate in a minute. Again, greatly understating cases. Netherlands, the United Kingdom, fairly accurate. United States, fairly accurate. Cases still going up in the United States. Some indication that in the United Kingdom we may have peaked. So we've got a green and a blue line here. Any guesses? Australia is the green line and Ireland is the blue line. So cases in Australia absolutely taking off. Probably most places apart from Western Australia, which is still closed off. So it'll be interesting to see what, I think it's Mark McGowan, see what he'll do about that. Because as soon as the borders open, if there's free trade or free movement between all of Australia and Western Australia, basically everyone in Western Australia is going to get it all of a sudden. New Zealand's in a similar situation, actually. So they're new cases. Variants, well, Omicron, obviously, they're still underreported. I mean, the United States, the Omicron we know is about 95% now, so it's still underreported, but they are catching up as Omicron sweeps the world, and this is the good bit, sweeps away Delta with it. Delta is being swept away by Omicron, which is good. Although in some places we still have a bit of both, that's the problem. But Delta is on the decline as Omicron outcompetes it. Number of COVID patients in hospital. So as we see, Japan, now the hospitalisations in Japan are accurate as they are in Netherlands. Australia, in fact, all the hospitalisations here are accurate, United Kingdom, but the United States way out ahead in terms of hospitalisation, which is a concern, just starting to level off, hint of a reduction there in the UK. Intensive care, well, likewise, United Kingdom, in intensive care admissions have actually gone down. Japan there low, Australia going up a bit, Ireland, Netherlands, Canada is increasing, and these figures from Canada are accurate as far as we know, but the United States again, just incredibly high numbers in the United States, and that's what we're going to look at in a minute. R values, well, there's the R value of 1 there, so anything above that is increasing. So the United Kingdom is just about on about R 1.1 now, or just over 1. Ireland, the United States, Netherlands, Canada, Australia, India. This is accurate for India. Japan. Because of the small numbers in cases in Japan, we can't put too much emphasis on that, really. We can't overinterpret that. But the United States and Canada, we still see, are definitely going up. And this is despite massive underreporting in Canada. New daily confirmed cases per million. Just another few countries we watch here. So just by way of comparison, really, Sweden, Belgium, United Kingdom, United States, Spain, Italy, Portugal, Denmark, Israel, Australia, France, and the very heavily vaccinated. Vaccines in Gibraltar about 140%. Again, very rapid rise in the number of cases. How that's resulting in hospitalisations? Well, again, the United States well out ahead, then France, Spain, Italy, United Kingdom. Then a few other countries lower down. But again, the United States we see, I'm afraid, leading that particular pack in terms of hospitalisation. So what is going on there is a pretty good question. Now, just before we go on to that, I just want to give a quick message here from Steve, Ontario, Canada. Largest province in Canada, 15 million people. Several weeks ago, we were told to stop going for testing unless we were in a high-risk category. So the number of cases is dramatically underreported. So when you see cases in Canada dropping and the R-value decreasing, it's completely inaccurate. And Ontario is almost half the population of Canada. So pretty pathetic reporting of numbers there from Canada. They're just not testing. Or is this encouraging because we're moving to the endemic phase? It's an interesting question. Now, just before we look at the US hospitalisation situation, let's just look at some more data from the United States. Now, first of all, we see the increase in number of cases. Now, this is the million line. This is the 1.2 million line. So we saw that dramatic number of cases recently. Absolutely huge, well over 1.2 million. The most recent, though, there is on about 800,000 cases. So probably averaging about 800,000 cases a day in the United States. Always a bit of a delay in the US data. I mean, that's 3 days out of date, but that's what we've got. Now, hospitalisations here. Now, again, this is a bit out of date. This is of the... Actually, it's not too bad. This is the 11th of January, so this is quite reasonable. Cases, of course, going up. These are hospitalisations in the States, so going up during the different waves. This was the Alpha wave. This was the Delta wave. Great increase in hospitalisations. These cases, of course, are greatly underestimating the total number of infections. And we have to assume that these Omicron cases here are also greatly lower than the number of actual infections. The cases are a very small subset of infections. But we do see this concerning rise in hospitalisations in the States here. Really quite high. Now, this is in young children. Now, these are the older age groups, 5 to 11, 12 to 17. But we do see, and this is consistent with the report, the reason I put this in, I've been getting reports from colleagues in India on this just this morning. 0 to 4-year-olds are getting more symptomatic infections. Now, the number here, this is the number of hospitalisations, still very low. We're still talking about just over 4 per 100,000 of the population, but definitely higher than it has been in this very younger child age group. So this is the 5 to 11, not so bad. This is the 12 to 17. Now, this, to be fair, is only up to the start of the new year. So a lot of this, in fact, it's not even that, it's up to about the 28th of December. So a lot of this, we can probably still assume that many of these cases in younger children under the age of 4 are Delta. There's not time for Omicron hospitalisations to come through by the end of December in these numbers in the United States. So I think we can assume that that is largely a Delta-driven phenomena. So hopefully as the Omicron takes over, the number of young children under the age of 4 in hospital will go down. Community transmission in the States, of course, is pretty high. And this is the entire world. This is the global numbers. So we can see that the numbers of cases being diagnosed in the world are highest than they've ever been. Over 3 million per day. And given the underreporting in India, I suspect that's nearer 30 million per day at the moment, to be quite honest, because we're just being so underreported. Now, getting on, before I look at UK data, let's just look at some of these reasons that hospitalisations are increasing in the States. So the big thing is, are people being admitted with COVID as an incidental thing or for COVID because it's making them sick? Is the big question. So this is the question, and we'll find out it's even more complicated than this false dichotomy. So Jeremy Faust, emergency physician, Massachusetts. The truth is we're still in the emergency phase of the pandemic, according to Dr. Faust. And everyone who is downplaying that should probably take a tour of a hospital before they do. So hospitalisations still concerningly high, at least in Massachusetts, and this is reflecting the whole country. Now, Dr. Sara Murray, San Francisco. If a virus that causes less severe lung disease affects an extraordinarily large proportion of the population, and it's just going through absolutely everyone, then Dr. Murray's saying you'll still get a lot of them in the hospital with severe lung disease. So even if it doesn't cause much lung disease, you'll still get a lot of people in with lung disease because everyone's getting it all at the same time. So what are the factors in hospitalisations in the States? Why are they higher than other places? So low vaccination uptake in some areas. Huge amounts of comorbidities in the States. Obesity, high blood pressure, heart disease, cerebrovascular disease, peripheral vascular disease. Residual circulation of Delta. So there's still quite a lot of Delta hospitalisations going around. And post-Delta infection, we know, is associated with increased risk of hospitalisation. Omicron areas, there are lower risks of hospitalisation, so hopefully it's going to carry on reducing. Now, Dr. Michelle Walensky, CDC, of course, I suspect the deaths we are seeing now are still from Delta. Now, this is encouraging that given that Dr. Walensky has got access to all of the CDC data, of course, she's thinking that most of the deaths are from Delta. So almost as if the quicker Omicron comes, the better, really. I don't think we can say that yet, but we do know that Omicron is displacing Delta. We do know that Omicron is causing less severe illnesses. So Omicron could turn out to be a major blessing to the human race. But that's me thinking out loud. What we can say for sure is Dr. Lewinsky says, I suspect the deaths we are seeing now are from Delta. James Lawyer, infectious diseases physician, Nebraska Medical Center. The vast majority of our COVID positive cases are at the hospital for reasons related to their COVID infection. So very much downplaying here the incidental findings, according to Dr. Lawyer. So he's saying it is COVID related. So this idea that there's two neat categories are patients in hospital with COVID or from COVID or with COVID or for COVID because the COVID's made them sick. It turns out to be a completely false dichotomy. It's much more nuanced than that. So two neat categories with and for COVID. No, that's not the case. Vanetta Aurora, hospital doctor, University of Chicago. If you're on the margins of coming into hospital, COVID tips you over. So what she's saying is we've got all these comorbidities in the States, people that are on the margins of getting sick anyway. And if they get COVID, just that, what she's saying really is it's the straw that breaks the camel's back. It's the last thing that actually tips people over into hospital because of the large amount of comorbidities. COVID might not be listed as a reason for admission, but no COVID, no admission. So even though COVID's not listed, if they didn't have COVID, if they didn't have the additional factor, they might not be admitted. And the point is, everyone's getting COVID now, so this is causing a massive surge of admissions. There are infections, but that's causing a massive surge of admissions. So what seems to be happening is we've got this mass of people with comorbidities in the States. And then we've got this massive overlay of Omicron on top of it. And that Omicron is just the extra few percent that is tipping people with those comorbidities into hospitalisation, whether it's cerebrovascular disease, heart disease, diabetes, renal failure, chronic lung disease, chronic hypertension, chronic obesity, whatever it is, it's just tipping them over the edge. So it seems like this is exacerbating the massive comorbidities in the States. This seems to be the main reason. These incidental infections are not so incidental for people with chronic conditions, Dr. Aurora says. So it might be incidental to you and me, but if you've got chronic conditions and your health is on the balance anyway, then that's enough to tip you over. And she says we have lots of chronically ill people in the United States, and it's like all of these people are now coming into the hospital at the same time. This is the problem. So really, I've concluded that it's three categories. There's three categories. People that are admitted for COVID because they've got problems related with the COVID. people with COVID that's exacerbated a chronic condition, and truly incidental, so someone who breaks their leg, gets an appendicitis, has a road traffic accident, found to be COVID positive when they get in. So the vast majority are probably this category here, that COVID is exacerbating chronic conditions, of which the United States is not short. They have plenty of them, and that is probably what's causing most people. So yes, some purely for COVID. A lot of those exacerbating conditions, some are indeed truly incidentals. This truly incidental category is the minority. Craig Spencer, emergency physician, Columbia University Medical Center. The healthcare system is in crisis, on the verge of collapse. Right, doesn't sound good, but we must agree. It doesn't matter whether it's with or for, it's pure deluge of numbers. And many of it's an exacerbation of a chronic condition. So the United States, I mean, there's plenty of chronic conditions in this country, but this is something that really needs to be addressed. Things like diet. I mean, my diet's not brilliant, but I've only been to the States a couple of times. But I remember I once spent 20 minutes looking through all the bread in one of the supermarket chains and couldn't find one without sugar. I mean, what do you want to put sugar in bread for? Anyway, that's just one of the things I've been thinking about, that maybe this is time to think about new community health policies for the States. Now, Mr. Biden in the States is strongly advocating vaccines, of course. And what was his name? Just a minute, I've got it written down. Mr. Donald J. Trump, also saying boosters, talking about boosters, politicians who refuse to say whether they've received one were gutless. So if you're a politician and you're in the United States and you haven't declared whether you've had a booster or not, Mr. Trump would, from this, consider you gutless. What you do with that information, of course, is up to you. So following Mr. Trump's guidelines, I will declare my vaccination status. Most of you know already. I had 2 Pfizers as the first and second, and I had a Moderna as my booster. So that's what I've had. Didn't ask for them. It's just what we were given. You just turn up, rock up, and that's what you're given. So had no choice in any of those, but that's what I had. So there you go. So Mr. Trump again. The fact is, I think the vaccines saved tens of millions throughout the world. So we can see that Mr. Trump is clearly advocating vaccines. Mr. Trump himself has had a booster, which is good because he'll be more protected. And he believes that vaccines have saved tens of millions of lives around the world. So for adults watching in the States now, you can follow one political leaning and be vaccinated, or you could follow the other political leaning and be vaccinated. So nice to see an area of complete agreement between Mr. Trump and Mr. Biden. Now I'm going to just give you a few. I think I'll just do one today, but just some of your experiences with the recent infection. So this is Di Sufnik. I've had COVID-19 for 3 days now. Second vaccination dose 1 month ago. So Di has had 2 vaccine doses. Had COVID for 3 days, and this is only written a couple of days ago. It just feels like a bad case of pharyngitis. Good, I'm glad it's not worse than that. Congested sinuses, gunky sore throat, and bronchial tract inflamed. Occasional painful aspiration. I suppose that means breathing, deep breathing, but nothing like when I had double pneumonia, dear me. Oximeter reports 95 to 98, which I would consider essentially normal. Well, it is normal. The whole of the time, so far reassuring. So Di has had a fairly mild case there, and many of you have, and we'll be looking at some more experiences of people, the experiences that you have had with recent infections over the next few days. So I think we'll leave that there. Oh no, I was going to show you the UK data, wasn't I? Just some brief UK data here. Here we are. So cases by date reported. Well, in the UK, it does look like the reported cases are going down. And this is against a background of quite reasonable levels of testing. We're not in a Canadian situation where the testing's poor. So has Omicron peaked in the UK? Possibly. And this is actually consistent with the COVID symptom tracker data, which is showing a levelling off and a slight reduction in symptomatic prevalence in the UK as well. So could it have come this early? It could well have been. It could well be this early. Patients admitted to hospital. Well, again, basically, I think we'd have to see a levelling off to a slight reduction. Now, these are patients actually admitted to hospital. You don't really see this reduction in patients that are actually in hospital at the moment. But this is encouraging. And cases in London are much lower than cases in the rest of the country. So London, I think we can say cases in London now have definitely peaked. So that's why I'm optimistic that these are genuine reductions in cases in the rest of the UK, because we're following on about 10 days behind the London situation. And patients admitted to mechanically ventilated beds. Now, this is not patients mechanically ventilated. This is just patients admitted to intensive care. And we see as Omicron has increased, this has continued to go down. And I believe that the reason that the cases have plateaued, perhaps in the UK, and are certainly going down in London, is widespread natural immunity generated by the Omicron variant, synergistically combining with the immunity from previous waves and the immunity from vaccination. But people who've been exposed to Omicron, who've been vaccinated, will have had a very, very nice immune boost. Thank you very much. Which, of course, is really, really good news. And on that note, thank you for watching.